Hi guys, this is David Villar and welcome to the second video on toxicants that affect the kidneys. On this video we will discuss the intoxication by lilies and alcohols. To begin with, we have to differentiate between true lilies from those that are non-toxic but are also commonly called lilies. The true lilies are in the Lilium genus, and as you probably know, these are very common plants grown in gardens. The flowers are large, often fragrant, and they come in a wide range of colors. They are borne in umbels at the top of the stem with 6 tepals. And the most common one used as an Easter tradition is Lilium longiflorum with the typical white trumpet shaped blooms. And these are actually native from Japan. As you can see, there are also other plants commonly known as lilies, which are not true lilies and they are non-toxic. A few examples are the Peruvian lily, the calla lily, and the peace lily. What is the most common scenario? Well, during Easter time, people buy Easter lilies and they bring them into the house, where cats, being as nosy as they are, will chew on those leaves and flowers and may even ingest parts of the plant. Here is an indoor cat that was brought to me for a diagnostic workup during Easter time. And as you can see, they treated him with IV fluids, but if the kidneys are already in shutdown mode, those fluids usually end up in the lungs, and he probably died from a pulmonary edema and hemorrhage. On these photographs, we see a normal looking kidney from a cat at the top on the top image, and the kidney from that one cat that we just saw. The big arrowhead is showing a tubule that is necrotic and has lost all the epithelial cells. There is some debris inside the tubules, whereas other ones seem to be empty. And the small arrowhead is actually pointing to a tubule where the nuclei is disintegrating in one of those epithelial cells. In all the cases, the basement membrane is found to be intact, and that's actually an important finding because the tubule may repair if the animal can be kept alive long enough. Basically, the scaffolding of the tubule is okay, so whatever epithelial cells are left on could start replicating and restore the function of those tubules. Now, the clinical signs of lily toxicosis follow a fairly consistent time course, which is described on this table from the book by Plumley on clinical veterinary toxicology. The table heading is onset and duration of common clinical signs and clinical pathological changes that occur with lily poisoning in cats. The initial syndrome starts with vomiting, salivation, anorexia, and depression in the first 3 hours after the ingestion. The depression and the anorexia will continue for the duration of the syndrome, but the vomiting and the salivation stops after those early hours. And this is important because it may lead owners to believe that the cat is recovering from a mild gastrointestinal upset, and that can delay the immediate start of treatment, which we will discuss next. So the clinical syndrome is going to progress into the life-threatening phase and the anuric renal failure. Before the anuria, the cats develop a polyuric phase between 12 and 24 hours. And at this point, you can tell that the kidneys are already starting to get damaged because there will be proteinuria, glycosuria, isostenuria, and the polyuria will cause severe dehydration. Now, after 24 hours, there is already enough damage, and if you take a blood sample, those renal parameters of BUN, creatinine, and phosphorus will be elevated. And when the anuria starts, the animal will resume vomiting, will get very weak and recumbent, and die unconscious. And in most cases, they die between 3 and 7 days after the ingestion. What are we going to do for management? We cannot wait to see what happens. Most of the cats will have vomited before the clinical presentation, but we should still act quickly, assuming that the lethal dose of the toxin may still be present in the body. So we should decontaminate the GI tract to minimize any further exposure to the plant toxins. And if the animal has already vomited, this includes activated charcoal with a cathartic, And the most critical treatment is the initiation of fluid therapy to protect those kidneys and to restore the dehydration. Now, the earlier we start the fluid therapy, the better, because if the animal starts showing oliguria, it may be too late. If we can monitor urine output, it will give us probably the best indicator that the kidneys are still working fine or maybe already failing. And if the animal is not producing urine, the last option we have is either peritoneal dialysis or hemodialysis. And at that point, giving drugs like dopamine or furosemide or mannitol on top of the fluids will most likely be very unsuccessful. Now, there are cases reported in the literature where they performed peritoneal dialysis for 10 to 14 days, and the animals actually regenerated those tubules and resulted in a return of renal function. So remember that the basement membranes are intact, which give us the opportunity for the tubules to regenerate. If there is GI signs like protracted vomiting with azotemia, we should probably relieve the animal with antiemetics and GI protectants. Now let's move into the toxicity of alcohols. There are three types that we need to discuss, which are ethylene glycol, methanol, and propylene glycol. They all have a sweet flavor, and you definitely don't want to leave them to the access of dogs and cats. And they all have in common having hydroxyl groups. That's what makes them alcohols. For ethylene glycol, the main source of exposure is antifreeze that is used in motor vehicles. And if we look at the structure, the only difference with ethanol is another hydroxyl group in the molecule. With methanol, this is usually found in the windshield washers or other cleaner solutions. This is actually the one used for fuel in picnic stoves. And propylene glycol is also used as an antifreeze. And if you work with cattle, this is used to treat ketosis. It is the least toxic of all three of them, but with large ingestions, it can also be as toxic as we will see with a clinical case. Now, to comprehend why they are toxic, we have to look at their metabolism in the body. The first reaction in their metabolism is by the enzyme in the liver, which is called alcohol dehydrogenase. The alcohol molecule gets converted to an aldehyde, and the next reaction is carried out by aldehyde dehydrogenase that converts them into carboxylic acids. For ethanol, the acid is acetic acid that is used to produce energy. For methanol, the formaldehyde becomes formic acid, which is quite toxic and will cause severe metabolic acidosis. And for ethylene glycol, all those metabolites are very toxic. And the last one is oxalate that will bind calcium and produce crystals that destroy the kidneys. Now, ethylene glycol in itself is not very toxic until it gets converted to those metabolites. So if we can prevent that initial reaction, we can save the animal by giving him time to eliminate the ethylene glycol intact through the urine. And this is where ethanol comes into play as an antidote for ethylene glycol. Ethanol has a much higher affinity for the alcohol dehydrogenase compared with the ethylene glycol, and as long as it is in the body, that enzyme will be busy and will not touch the ethylene glycol molecule. Now let's start with ethylene glycol. The minimum lethal dose of undiluted liquid is between 4.4 and 6.6 mils per kg. This is about 1 teaspoon per kilogram of body weight. Cats are more sensitive, and with just 1.5 mils per kg, which is about 1/3 of a teaspoon, can be lethal to them. So as you can see, just 1.5 teaspoons can be lethal to a 10-pound cat. The clinical syndrome of an intoxication has 3 phases. The initial one in the first 12 hours, in which the molecule has not metabolized too much, is basically of an animal that looks drunk. You may see some CNS depression, ataxia, polyuria, polydipsia, vomiting, and this actually mimics an ethanol exposure. Now, occasionally they could seizure, enter into a coma and die, but most commonly they seem to recover temporarily. On the second phase, between 12 and 24 hours, there is cardiopulmonary involvement that includes tachypnea, tachycardia, weakness, and this is all because of the severe metabolic acidosis. And with the third stage, after 24 hours, they develop acute renal failure, which is unfortunately when the animals are mostly presented to the clinic. And at this point, we see severe depression, the vomiting returns, we have oliguria or anuria, abdominal pain in the kidney areas. In cats, the progression of these phases is a lot faster and will be on stage 3 after 12 hours. And in dogs, this will be a little bit later, between 32 and 72 hours. Now, dividing these phases makes sense from an academic point of view, but remember that there is a considerable overlap between these stages. Not all the animals are going to read the book, and death can actually happen in any stage. Now, with regards to the diagnosis, there are several in-house tests that can be used early to detect ethylene glycol. Usually a drop of plasma is deposited on a test strip, and a color change indicates whether the sample contains ethylene glycol. The problem with this quick test is that they lack specificity, and and there are many false positives that can happen with any other alcohol, like the ones we list here. So the best option is actually to send blood to a human hospital or a veterinary toxicology lab. Now, other tests that can make an early diagnosis is measuring anion gaps or serum osmolality. Ethylene glycol increases the osmolality by depressing the melting point of plasma. And if you do a urinalysis within a matter of 3 hours, you can detect a low specific gravity and maybe some of those calcium oxalate crystals, like we see on this image, that they actually kind of look like a coffin. Now, as the syndrome progresses, there will be increases in BUN, creatinine, phosphorus, and in most cases there will be hyperglycemia and hypocalcemia. How do we make a diagnosis on a dead animal? The lesions in the kidney are almost pathognomonic. When a polarizing lens is placed above the slide on that microscope stage, and another is held below the microscope stage, the scene looks like a Christmas tree. This is actually from a dog that I diagnosed, and it shows all those calcium oxalate crystals, which are bright and have a rosette shape. This is another view from that same kidney as we just saw, and you can tell the tubules are very dilated, and there is a lot of damage, which is caused by both the glycolic acid and the obstruction and the degeneration by those pale yellow crystals. As I say, this is almost pathognomonic in dogs and cats. What can we say about the treatment? Well, all the veterinarians I talked to said they hate these cases because by the time the animal gets to the clinic, it's usually too late. And the success of the treatment is going to depend on 3 things. Number 1, a limited ingestion and absorption. Number 2, a rapid diagnosis and intervention. This is within 8 to 12 hours in dog, and only 3 hours in cats. And the third one is a very aggressive treatment. So the treatment basically is the same as for an acute renal failure, together with one of the 2 antidotes that we're going to discuss next. These antidotes block the alcohol dehydrogenase, and they give the animal time to eliminate the ethylene glycol intact, such that every time the molecule goes through the kidney, it gets secreted by glomerular filtration, and it goes out with the urine. The 2 inhibitors of the enzyme are ethanol and 4-methylpyrazole. If you can use 4-methylpyrazole, it does not have the adverse effect of ethanol. The problem with fomepizole is that it's several $100s, but if the owner can afford it, this is actually the way to go. Ethanol is kind of a double-edged sword because it will worsen the acidosis, it will cause severe CNS depression, and pulmonary edema is another complicating factor, particularly if there is already kidney damage. If you look at the protocol, the treatment has to be given for 2 days in dogs and 3 days in cats. And the other thing, just as important as the ethanol or the fomepizole, is correcting the acidosis. When plasma bicarbonate measurements cannot be made, it is still critical to correct the acidosis. So I just put here kind of an estimated dose of sodium bicarb, which is about 6 milliequivalents per kilogram. And you have to give this at the same interval as the antidotes. So you can actually mix them together and give them IV. Now here is a pretty good paper that determines the safety and the efficacy of high-dose fomepizole compared with ethanol in cats with ethylene glycol toxicosis. They found that higher doses are necessary in cats compared to dogs, but it is safe and prevents the fatal acute renal failure. This has to be instituted within 3 hours of the ingestion in cats because they found that after 4 hours they develop acute renal failure whether they were treated with ethanol or fomepizole. Now the next one is methanol. This is another devil, not only for animals but also human that happen to ingest adulterated liquor. Just like we saw with ethylene glycol, the metabolites are more than 30 times more toxic than the methanol itself. There is something unique to humans, which is that the formic acid inhibits a cytochrome oxidase in the optic nerve that disrupts the axonal conduction, and it causes optic disc edema and ultimately blindness. The minimum lethal dose is 5 to 11 mils per kg. Humans are a lot more susceptible with just 1 mil per kg. So if they drink just one drink of an adulterated liquor, they could die. In this case, kidney failure does not happen, but the animal will die with CNS effects and the metabolic acidosis. The CNS include depression, ataxia, weakness, and coma, and the metabolic acidosis is responsible for the abdominal pain, the vomiting, the tachypnea, and the death from respiratory failure. Now, with regards to the treatment, there is no specific antidote. Neither ethanol or fomepizole are indicated, and the mainstay of the therapy is to reduce the metabolic acidosis. We need to administer fluids with sodium bicarb. So ideally, you should do some blood gases to determine how much bicarb deficit there is and adjust the therapy accordingly. Now the rest is to provide respiratory support because, as we said, animals tend to die with respiratory failure. And the last one is propylene glycol, which is also used as an antifreeze, also in some solvents and hydraulic fluids. This is the least toxic of the 3 alcohols, with an LD50 orally in dogs of about 9 mils per kilogram. Doses of 5 milligrams per kilogram daily in dogs caused a hemolytic anemia, reticulocytes, and hyperbilirubinemia. And at 2 milligrams per kilogram per day, there were no effects. Now, cats are more susceptible, and in fact, they have been poisoned with moist pet food containing more than 5% of propylene glycol. So the clinical signs are basically of a half-body anemia in cats, and the neurologic signs are those of ataxia, CNS depression, muscle twitches, lactic acidosis, and an osmotic diuresis that causes dehydration. So even if it is less toxic than ethylene glycol, it may still look like an ethylene glycol, at least in the initial acute phases. Now, in this paper, they describe the clinical course and the treatment and the outcome of a dog with propylene glycol intoxication. The case was of a 11-year-old Australian cattle dog presented to the emergency clinic. The dog developed acute onset of ataxia and disorientation with obtunded mentation and sternal recumbency. And at the clinic, he vomited a large quantity of clear fluid, liquid, mixed with grass. The animal was actually roaming at a construction site 3 hours prior to being presented in the clinic. The blood gases demonstrated a metabolic acidosis with a compensatory respiratory alkalosis. Creatinine was mildly elevated, total calcium was slightly lower, and glucose was high. Now, there were no crystals in the urine, which is already an indication that ethylene glycol is probably not involved. And a point-of-care blood test was extremely positive for ethylene glycol. But as we just mentioned earlier, those alcohols will yield false positive results. So they suspected ethylene glycol, and the dog was immediately placed on ethanol. They established a urinary collection system and sedated the animal with butorphanol and diazepam. And after 7 hours of the onset of signs, he was started on hemodialysis. Meanwhile, they sent some blood samples to the California Veterinary Diagnostic Lab. They did some sophisticated gas chromatography, and they detected propylene glycol. But there was zero ethylene glycol. The results are shown on that table there, and they say that the serum levels of propylene glycol were as high as the highest ever reported in human literature. Now, as the story unfolds, the animal made a complete recovery the next day and was sent home with the owner. And on the discussion, they mentioned that patients with propylene glycol intoxication closely resembled those of ethylene glycol toxicosis, because they all exhibit ataxia, altered mentation, high osmolarity, and a metabolic acidosis. In this case, they could not wait to get the final diagnosis, so they started the dog on ethanol right away. But for whatever reason, they did not put the animal on hemodialysis until 7 hours after the onset of signs. Now, in the end, they said that the ethanol caused severe CNS depression, and in this case, it made the recovery slower. It was not necessary, but as we just mentioned, withholding treatments in patients with ethylene glycol could be lethal. So when in doubt, you definitely want to err on the side of caution and start treatment right away, as if it was with ethylene glycol. So this is the last slide. We'll talk about more toxicants that cause kidney failure on the next video. So until next one, take care, guys, and bye-bye for now.